Hello, I am so excited to be here today. I get to talk about a very important topic. Over the last 2 days, I have reached out and given you a little bit of information on plantar fasciitis so you can determine if you have the plantar fasciitis in your life. Do you have the inflammation of that plantar fascial ligament, or is it something else? And also, what can you do to treat it yourself? There are so many individuals that are suffering with plantar fasciitis that it was important that I feel that we give this information so you can find the solutions yourself, especially in this time when you're limited about getting out and being able to do things. So with that being said, today I'm going to take that just a step further. And the question that I am commonly asked is, does my child have plantar fasciitis? They have the same type of symptoms. They may be getting up in the morning and their feet hurt. They may have a problem running. They may have a problem walking because they're limping all the time because their heels are just killing them. They may even have symptoms that are radiating up to the ankle, and they're saying, okay, I am hurting so bad, I don't want to walk. That's not common for children. Children should want to walk. They should want to go out and play. They should want to go out and do things. But when their feet are hurting that bad, it interferes with everything that they like to do. So the question is this plantar fasciitis? Now, I'm going to give you a quick answer. The answer is no. And then I'm going to give you a little bit of basis for this. About 99% of the time, kids do not have plantar fasciitis. Why is that the case? The plantar fascia, as you remember, is a ligament on the bottom of the foot. It gets inflamed, painful because of injury. Now, kids have a lot more elasticity than you or I have. And because of that, that injury to the plantar fascial ligament is unlikely because the plantar fascia, when you stretch it, will stretch and then recover because of the elasticity. We're missing some of that elasticity. That's the reason we get wrinkles. That's the reason that we injure ourselves more easily as adults than we did as kids. And that is the reason that we have things that sag that didn't used to, because we've lost that elasticity. We don't get that rebound effect of it coming back. Same thing happens with the plantar fascia. When you stretch the plantar fascia, you injure it. When you stretch the ankle ligaments, you injure them, whereas a lot of times in kids, they have an easier time recovering, an easier time getting back because of the elasticity they have in their tissues. So what is this problem? Why are they having heel pain? Why are they having shooting pains up their ankle? Why are they having problems when they go running for a little while? They run for a period of time in their sport and then they start to limp. It is a condition called Sever's disease or calcaneal apophysitis. Physis or apophysis is the growth plate, and apophysitis is an inflammation of that growth plate. So to give you a little bit of an example, here's a normal adult foot. In a kid, you're gonna have a growth plate right at the back of the heel, and then you're gonna have another piece of bone that sits behind that the Achilles tendon attaches to. So when they run, it pulls on that growth plate, and the growth plate itself gets inflamed, painful, and tender, and becomes really problematic. A lot of times it will even feel like they broke their foot. And they're having so much pain that they can hardly even walk or want to walk. So is this the case of what's going on with your child? Most likely it is. Now, calcaneal apophysitis or Sever's disease occurs usually between the ages of 11 and 16. It used to only be diagnosed or seen in soccer players and only boys. We're now seeing it boys and girls. We're seeing it in soccer, basketball, football, baseball, softball, dance, gymnastics, most of the running sports. We're just seeing it constantly in all different types of athletes because they're just more active. They're doing more things. So because of that, there are more of them that are getting that inflammation of that growth plate in the back of the heel, and they're having a problem being able to continue in their sport the way they want to. This will occur, I guess, the best way to explain it, earlier in girls than it does in boys. Typically, girls will be done with their foot growing by the age of 14, and boys it usually goes until about 16. So you can see it at any point during that period of time, and it may come and go. We have periods of time where it's really problematic, then it goes away for a little while, and then comes back. And a lot of times it correlates directly with the amount of growing that they have. So this would maybe be one of those definitions of growing pain, even though I don't believe in growing pains. I don't think growing should hurt. But you can get growing pains based on things that are caused by that rapid growth. And in this case, the growth plate itself is getting inflamed because the Achilles tendon is pulling harder on the growth plate in this area. So your child has calcaneal apophysitis. They have inflammation. What do? There's really only two options. Well, there's three options. One of them I don't usually recommend because It's a stupid option. The first option, the one I don't usually recommend, is they stop doing things. They stop being active. They stop participating in their sports. That's a stupid answer. It doesn't work. And a child that really likes soccer or really likes basketball or whatever, they're not going to stop anyway. They're just going to suffer and hurt. And that makes that not a good option. Would that fix the problem? Yeah, if they stop running, stop doing things, they sit around all the day, their growth plate's going to stop hurting in a 2 to 4 week period. But that's not a good option. So the most common option that I use, the best option typically, is to use something called a heel cup. It basically looks just like this. And the disadvantage of the heel cup is they're hard to find. It's hard to get your hands on them. We carry them here just for this purpose. And I have people all over Utah County, for example, that are wearing these heel cups so they can continue to participate in their sports, continue to run around and act like a kid, like they should be able to. So this actually works really well. And it has to be hard. It can't be the rubberized ones that you can find at the stores like Walmart and so forth. They need to be hard plastic for 2 different reasons. One is it pulls the fat pad back underneath. So you get the padding, the natural padding that's supposed to work on the foot underneath that heel to protect that growth plate a little bit from stepping down so that it decreases the pain. It also keeps that Achilles tendon from being able to pull off on that growth plate area because this is hard and doesn't allow it to pull away. So how would you wear it? If you take this heel, you basically slide it right on. It only fits one way. It does not work that way. It's going to only fit one way. So it fits like that. Like it said, it pulls the fat pad back underneath and it keeps the Achilles tendon from pulling away. It can be worn under or over socks and it will usually fix the problem. Now that being said, in a small percentage of individuals, this is not enough because they have a walking abnormality or a gait problem in the way that they run, the way they walk, that's causing more issues. And they may need to go into more of a custom orthotic, a specialized insert or custom orthotic that will change the way they walk to reduce that stress of that Achilles tendon to that growth plate. Most of the time that's not needed. Sometimes it is. For that reason, I recommend that they come in, be evaluated, get an x-ray and confirm, one, that they have calcaneal apophysitis. They will be on an x-ray, you'll be able to see an inflammation of that growth plate. You'll be able to see a hardening of the bone that's closest to the Achilles tendon. It'll actually turn a brighter white on x-ray, showing that you're getting stress across that bone. And because of that, you can say, yes, it truly is calcaneal apophysitis, and you try the heel cup for a couple weeks. Within 2 weeks, typically the pain will reduce or go away. And by using that heel cup, they keep it from coming back. There are individuals that will wear them for a while and they say, okay, the pain's gone. They stopped wearing them. If it starts to come back, they throw the heel cup back in. Simple fix, fixes the problem. Much easier to treat than plantar fasciitis because the truth is kids recover more easily. So, does my child have plantar fasciitis? 99% of the time, it will be no. They have calcaneal apophysitis or Sever's disease. And it can be treated. And it should be treated. Best way, heel cup. By using this heel cup, they can actually continue to do everything they want to do, and they'll stop limping. They'll stop hurting. And at least as far as the heel is concerned, they will stop complaining. So this is Dr. Brandt Gibson, and this is your podiatry tip for day number 3. Tomorrow, we're going to talk about the Achilles tendon itself and how you can have a different type of heel pain and what you can do for it. This is very common, especially in adults, as an overuse injury. If you're working more or you're running more, you're standing more, sometimes you will get these symptoms, and there are things that you can do for it as well as determine if that's really what's going on. So we'll see you tomorrow. The idea is to continue to give you these tips for a total of 30 days.